British Columbia's move today to decriminalize possession of certain drugs is getting mixed reactions from experts and advocates. Drug users will be allowed to carry up to 2.5 grams of opioids, such as heroin and fentanyl, as well as crack and powdered cocaine, methamphetamine, and MDMA. A 3-year pilot project in BC means users will not be arrested or have their drugs seized by police. Federal Mental Health and Addictions Minister Carolyn Bennett says the plan is to move people away from the criminal justice system and toward health and social services. Well, joining us now to give us more insight into these developments is Dr. Lindsey Richardson with the BC Centre on Substance Use. She's also an associate professor at UBC. Dr. Richardson, welcome to Forum Daily.
Thank you for having me.
So what do we know so far about the science behind this decision?
Well, we've long understood that the criminalization of people who use drugs has significant negative impacts, and it does very little to discourage drug use or decrease the illicit drug supply. And so decriminalization is really seeking to reduce negative interactions with police and the harm from incarceration, for example, including physical and mental health. It's aimed to reduce stigma and the consequences of stigma, as well as longer term impacts on things like employment or housing status or family stability.
I guess the big question here would be whether decriminalization is enough to tackle the opioid crisis and overdoses in the province.
I think it's really important to remember that decriminalization does nothing to address the toxic drug supply, which is the primary cause of the overdose crisis. And so decriminalization might not do much to reduce the risk of overdose at all. And so it's also important to remember that the change has serious limitations. So that threshold of 2.5 grams is too low to effectively decriminalize a lot of people who use drugs. And that includes people who are, for example, most commonly targeted by current enforcement efforts. And these are all things that put people at increased risk of overdose. I think another piece to remember is that it doesn't cover all substances. And so the opioid supply in Vancouver and in British Columbia right now is adulterated with fentanyl and benzodiazepines. And while fentanyl is covered, benzodiazepines aren't. And so there's a lot of question of some of the things that are key drivers of the overdose and opioid epidemic that we're currently in aren't necessarily going to be addressed by decriminalization.
It's clear that a lot more needs to be done here, Dr. Richardson. So, what types of supports are needed along with decriminalization for this to successfully reduce overdoses in BC?
Well, I think it's important to remember that there's no single change or intervention that is going to be the thing that solves the overdose crisis. It really requires a lot of movement in a bunch of different areas. But I think probably the most important thing is the creation of a safe and regulated, accessible drug supply to really address the fact that the drug supply is toxic. And alongside that, we need to address the social and economic drivers of drug-related harm and really develop a comprehensive, accessible, and culturally appropriate system of treatment, harm reduction, and social care.
All right, Dr. Richardson, what about supervised consumption sites? How are they impacting the opioid crisis, and what is missing when it comes to them in particular?
Well, supervised consumption facilities are critically important for providing a safer environment for people to use drugs, so that if they do overdose, someone can be there to address that overdose, revive them with naloxone or oxygen. But supervised consumption facilities are really limited in that not everyone has access to them, particularly in rural and remote locations, and that they are really a response to rather than the prevention of overdose. And so we really need to be thinking about ways of preventing overdose to begin with.
All right, Dr. Richardson, just a quick minute left here, but for some further perspective, we know a lot of advocates are pointing to something called a mental health crisis, according to some advocates in our country. So how closely is the mental health situation in Canada linked to overdoses and the opioid crisis?
Well, I mean, I think that's a really complex question. And a recent study by my team really identified that they are linked, that there is a linkage between mental disorders and non-fatal and fatal overdose. But again, what's important to remember is that overdose and drug use and mental disorders often have common causes, common triggers. things like economic disadvantage, colonization, racism, isolation, disconnection, chronic pain. And so we really need to be thinking about potentially common causes of both of those things.
Lots of important points to consider. Dr. Richardson, thank you again for joining us today on Forum Daily.
Thank you for having me.